Hey there, thanks for joining me for this training. My name is Joe Tatta. I am a physical therapist in the great city of New York. I live right in New York City on the island of Manhattan, and we're experiencing the coronavirus as we speak. I have friends and family who've been infected by it, and I have lots of colleagues who work in hospitals and medical centers around that can vouch for many of the stories that you hear. In the United States of America, we have a large amount of people who live with at least one, if not multiple, pre-existing conditions, or what we might term as non-communicable diseases. So I'm going to focus on that today during the presentation, as well as how nutrition can have an impact on coronavirus. Now, of course, we know currently, as of today, there is no treatment, there is no cure, there is no vaccine for the coronavirus. And this presentation is not intended to be a cure for the coronavirus or to suggest that nutrition can be a cure for the virus. What we're looking at is ways to support people through their condition, or to obviously reverse a potential non-communicable disease before it becomes a problem for people either with or without COVID. So let me just share my screen with you today. So as I mentioned, we'll be discussing COVID-19 and nutrition. I'll talk about a little bit about the stats of COVID-19 and some of the history of coronavirus. We'll of course go into pre-existing medical conditions, or what we term as non-communicable diseases, a big hotspot for the World Health Organization and many organizations in many countries. And we'll talk about nutrition and the coronavirus specifically. I just wanted to share some quick statistics with you before we begin. Living in the United States is somewhat interesting at times because we do not have a nationalized healthcare system here, meaning that our hospitals, medical centers, nursing homes, outpatient practices really have no way to communicate. The only way they can possibly communicate is by sharing their data with the CDC, also known as the Center for Disease Control. And that doesn't always happen. So it's good to find an evidence-based resource where people have very powerful computers and obviously very powerful minds that are working to collate information, of course, around the globe, but more importantly, from my perspective, for those of us who live in the United States. So I go to Johns Hopkins University and Medical Center. They have a coronavirus resource center. And if you go to the URL, which is up here, it's coronavirus.jhu.edu. And you can see they kind of give you an overview of global confirmed cases, global deaths, and then tested in the US. This is as of Monday, April 20th at 10:30 a.m. on the East Coast. This is how we look as far as the globe from the perspective of the research from Johns Hopkins University and Medical Center. And then, of course, if we go to the United States, that's what we're kind of talking about here as far as looking at non-communicable disease and nutrition, which we'll talk about in a little while. We have about 761,000 confirmed cases and about 35,000 total deaths. And then it gives you a nice map, and it shows you where kind of the hot spots are. And where I live, which is in the center of New York City on the island of Manhattan, is definitely one of them. So I just want to share this perspective with you as far as where we are in the United States. I know you may live in another country and stats may be different there, but we're facing very unique circumstances here in the United States of America with regard to COVID-19 and its impact with regard to outcomes for people living with non-communicable diseases. So when I mention NCDs, non-communicable diseases, we're talking about obesity, diabetes, cardiovascular disease, cardiopulmonary disease, autoimmune disease, asthma, those types of conditions. The coronavirus is kind of interesting. It's a family of viruses that are typically found in avians, which are birds, or typically small animals. This is not the first coronavirus that we have encountered as far as a public health concern. There was SARS back in 2002, and there was also MERS, which was back in 2012. And both of those viruses, like the current coronavirus, was transmitted from those small animals, typically birds or smaller rodents, to humans, and then humans, of course, spread it to other humans. COVID-19, of course, has its name because it was discovered in 2019 in China. The interesting thing about COVID-19 is when you look at the genetics of it, is that it's about 82% identical to SARS. So not to MERS. MERS is a little bit different, but it's about 82% identical in its genome to SARS. So with that, there are some lessons that we learned from SARS, which can be applied, or at least should try to be applied, to COVID-19. And we'll talk about some of those today. Again, I mentioned that we don't have a lot of good information in the United States for a lot of different reasons. Most of it's due to our public healthcare system, some of it's just because this is so new here. So the two places to look, of course, are China and Italy. Italy has some good data, I think, because it's a smaller country, and they've been able to produce some data. But when you look at the coronavirus deaths with regard to premorbid conditions, upwards of 99% of those who lost their life due to coronavirus had at least one premorbid condition, if not two or three. So if you look at the right side of that slide there, the half circle there, so almost about 50% of those who passed had three or more premorbid conditions, and about 25% had at least one chronic illness. So we know this, we've heard this on the news before, but it's always good to see what's happening with regard to statistics that are coming out of countries that are doing some studies. So this was released on March 17th. The link is below there. I'll send you the links if you're interested in it. They are in Italian, but it's if you speak Italian or maybe another Mediterranean language, it's kind of good to sift through the information and see exactly which premorbid conditions are susceptible to poor outcomes. Half of Americans have at least one chronic condition, which personally for me as an American, of course, as a healthcare practitioner, is extremely concerning just on an average day. But as soon as this started happening in the United States, I mentioned to my husband, I said, this is going to hit the lowest socioeconomic classes the hardest. And that's actually what happened. So when you look at what's happening in New York City and Detroit and some parts of Los Angeles, typically in the cities, those that have chronic conditions are the ones that we're most concerned about. Those are the people who are susceptible. Those are the people who are vulnerable. And those are the people that, we're concerned about. And to be honest, a lot of them are people that we see as physical therapists, especially people living with chronic pain. There is some research. This was just published on April 8th, 2020 in the Journal of Aging. Does comorbidity increase the risk of patients with COVID-19? Evidence from a meta-analysis. So they looked at approximately 1,500 people in about 8 different studies. And what they found was that those with hypertension, diabetes, chronic obstructive pulmonary disease, cardiovascular disease, and cerebral vascular disease are at major risk for developing COVID-19. So we have the research there. We know, in general, we know that people with compromised immune systems are more susceptible to many types of diseases, but it's always nice to see it in a meta-analysis, in an evidence-based study. So these are kind of the more specific list. I do think it's worth taking a look at these because sometimes we forget that there are young kids around that maybe have asthma, which could be predisposed, or maybe someone who had cancer many years ago, but still have some effects of, let's say, chemotherapy. They're considered someone who lives with a chronic disease. So it's nice to kind of have this list in your mind for yourself, for your family, for your friends. And of course, as you're starting to evaluate people, whether that's in the clinic, if your clinic is still open, or if you're now working remotely via telehealth, these are really just great opportunities to go through someone's history and just educate them about what a pre-existing condition is, what a chronic condition is, if they have one or two of these, and then to provide them with some education with regard to how they should proceed while we're under a stay at home, or potentially later on as we start to return back to normal life. Also going through, excuse me, also going through their medication history. Oftentimes people will say, well, I don't have any of those chronic conditions. Yet when you go through their medication history, that you'll find that there are certain types of drugs that are immunosuppressive in nature that people don't necessarily think of. And I kind of want to talk about a couple of those. The first one, and I bring up opioids because, of course, if you're a physical therapist, you're seeing people with pain, they may be on one or more of these medications. We have, believe it or not, they have recently eased the opioid restrictions since COVID-19, because oftentimes when people are placed in a medically induced coma and placed on a ventilator or a respirator, they're provided with these medications. And in the US, we have there have been orders in the US to decrease the production of opioids, and just recently that's been lifted. Now, of course, people may need these who are on a ventilator, but hopefully these are being prescribed responsibly. And let's say via telehealth, when someone cannot get to see a physical therapist, let's say in person or via telehealth, our hope is that a medication is not necessarily their go-to or not their only go-to. So we did a lot of great work in the US with regard to educating people about ways to prevent pain instead of opioids, so alternatives to opioids, and hopefully we don't see that turn around. But just so you know, opioids are known to cause a number of nutritional deficiencies, including all the ones you see on the screen on the right-hand side there. All the disease-modifying antirheumatic drugs, of course, suppress the immune system. Corticosteroids suppress the immune system. We mentioned morphine, other opioids. And then finally, the non-steroidal anti-inflammatory drugs. And I kind of want to talk about this. There's been lots of talk about this on the internet in certain blog posts. Let's kind of spend a minute here and talk. Now, I'll be honest with you, there's not a whole lot of information with regard to non-steroidal anti-inflammatory drugs and its adverse effects on the immune system. Why? I don't know. I can probably venture to say that these drugs are sold over the counter. They're probably one of the top drugs that are sold over the counter. There's not a whole lot of interest from large pharmaceutical companies to do research in this area and to show that potentially short-term and maybe long-term use of NSAIDs may inhibit the body's natural immune response of defense and repair. So this is an older study from 2009, but I want to share some of the conclusions or some of the results with you. So they looked at a wide amount of NSAIDs that are pulled over the counter, and they found that NSAIDs do blunt antibody synthesis by human B cells. And in fact, the higher the dose that you're on, and for the longer that you're on this medication, it's likely that there's some type of antibody inhibition that's happening by the immune system. So if you just take this drug, let's say if you have a headache one day, and let's say you just take 2 Advil, is there a concern? Probably not. We don't have a lot of research that supports that. If you're someone, let's say chronic low back pain, or maybe someone who suffers from migraines, and you take this drug, 2 pills, let's say twice a day, every day, and you've been taking it for decades, then there's some research to support that NSAIDs do weaken the immune system. And it can have consequences for everyone from children up to the elderly, and of course, those who are immune compromised. So again, I think it speaks to our practice as people who treat chronic pain and who tend to treat chronic pain naturally. So just a piece of education that you can share with your patients as well as your friends and family. Now, when you look at chronic disease as a whole, there's many different types of chronic diseases. The one that we think about most frequently is diabetes. And specifically looking through the lens or looking at the context of the coronavirus with regard to it being a respiratory infection, we know that those who have diabetes, specifically type 2 diabetes, are more likely to develop lower respiratory infections. So that this article looked at that. This is from 2015. And I'll just kind of pull some of the key points from here. Some of the main ones here, I think if you kind of drop down to the lower 2 check marks there, that it's thought that a malfunction in monocytes in patients with diabetes may contribute to the increased susceptibility of those with tuberculosis or other lower respiratory infections. And then finally, the kind of lower check down at the bottom there is that those with diabetes are 6 times more likely to have complications from flu-like viruses, including the coronaviruses, versus healthy adults. So it just shows you, again, I don't have time to go through every single chronic condition. We'd be here a long time today. Diabetes is often the model that we look at. Usually diabetes or obesity, they tend to go hand in hand. So just a quick little kind of infographic, if you will. Those with chronic disease are more likely to have a poor diet. That poor diet is more likely to cause nutrient deficiencies, and nutrient deficiencies are likely to lead to chronic disease. In the United States of America, we have what's called the National Health and Nutrition Examination Survey. These are very large
surveys that are done on thousands of people. And they found that the average American is typically deficient in vitamin A, C, D, E, and magnesium, although somewhere between a third and a half of all Americans may also be deficient in calcium, zinc, selenium, copper, iron, many amino acids, or in general protein, fatty acids, and of course folate. So it kind of gives you a snapshot of how the average American is coming into this epidemic or this pandemic. Nutrition is a very well-known social determinant of health. So both nutrition as well as specific dietary patterns are looked at with regard to social determinants of health. When you start to boil those social determinants of health down, we identify social inequality. So that can be anything from education in certain areas to someone's financial status in certain parts of cities and in certain parts of the United States of America. We have what's called these kind of food deserts where people don't have access to healthy food. If you walk into the grocery store, they don't have a produce section, or if they have a produce section, it's significantly small. There are psychosocial factors. So it's been found that basic nutrition education delivered by a variety of professionals, including physical therapists, can have an impact on someone's health education, and they're more likely to develop healthy eating styles when they're provided with some basic education that helps them make decisions. So there are psychosocial factors that are involved with the social determinants of health and with someone's choices for making healthy choices, whether it's at a restaurant, in a supermarket, or when they make their food at home. Environmental factors, that goes to the very wide, when we look at things like pollution having an effect on the environment, to the fact that certain people or certain parts of the economy may be very far from, let's say, a farm where they can have healthy fruits and vegetables that are delivered to them in their supermarket. There are cultural factors. So of course, certain cultures eat certain foods more than others. And then specifically the United States and of course Canada as well, there's dietary acculturation, which is when people immigrate or migrate from other countries, they're more likely to develop dietary habits in that country. So for example, if someone came, let's say, from a Mediterranean climate, let's say Italy, where they have a relatively healthy style of eating, and migrate to the United States of America, they're likely to develop the standard American diet, which has been linked to chronic disease. So a couple of things for you to keep in mind as you're developing both diet, nutrition, and exercise programs for your clients. These are things just to keep in mind and to kind of target with regard to education. If we're going to talk about nutrition, I'm going to go into some of the vitamins and minerals. We have to talk about dietary reference intakes. And there are 3 dietary reference intakes in the US that are very, very similar to what you have in Canada. There's the recommended dietary allowance, there's the adequate allowance, and then there's a tolerable upper limit. So the recommended dietary allowance is basically the estimation of a specific nutrient that you need to maintain your health. And when I say health, it's baseline health. So it doesn't take into consideration if you have a chronic condition or a disease. It doesn't take into consideration infection. It doesn't take into consideration if you're recovering from an injury or a surgery. It doesn't take into consideration if you are extremely active, let's say, and you need more nutrients. It's really your baseline of what you need to stay healthy. And then there's the adequate intake, which is the amount you need to avoid a specific disease or condition. And then there's the tolerable upper limit, which is, let's say if you take, for vitamin D, it's about 4,000 IUs. If you take more than 4,000 IUs, it's a chance you may develop some type of symptom. Of course, you've gone over the normal tolerable limit that the average human can take. At that point, you start to develop some symptoms. Sometimes they're very minimal symptoms. Sometimes they can be symptoms that require treatment. With regard to nutritional intake, of course, chronic disease, but I think the one population we want to focus in on, especially now during this pandemic, as well as after the pandemic is over, is the elderly. As people age, they lose their body weight as well as their muscle mass typically. With that, you also lose many types of nutrients in your body. So a lot of your nutrients are actually stored in your muscle, and they're actually stored in certain organs, and they're stored in bone. So as you age and everything basically begins to deteriorate and shrink, you're losing some of your reserve capacity. In essence, you're losing some of your metabolic resiliency. For the average person, they recommend about 8 grams of protein per kilogram of body weight. For those that are elderly, they recommend 1 gram per kilogram of body weight because people tend to have a problem digesting or absorbing amino acids. And they need more because typically sarcopenia is a problem. Calcium and vitamin D are the other two. And then it kind of as you go down the list, vitamin A, all the B vitamins, vitamin E, calcium, and zinc are all required at higher doses for people who are older. And typically this is also well recognized for people who have a chronic disease. So kind of let's dive into some of these, and I'll give you some recommendations, both along what the average daily recommendation is, as well as the tolerable upper limit, and then what the research says with regard to types of coronaviruses, not necessarily COVID-19, but different types of coronaviruses that have been studied. So the first is vitamin D. Vitamin D is a sunshine hormone. So the best way to get vitamin D is to expose your arms and legs or your chest and back to direct sunlight anywhere between 10 to 30 minutes a day, depending on the pigment of your skin. And typically, you know when that is the right dose because you tend to start to get a little hot and your skin starts to get a little bit pink. Most of us live in places where the sun doesn't shine very well for a long period of time, New York being one of them. Vitamin D is a vitamin. It's also known to be a very powerful hormone that helps with bone resorption. And it also stimulates immune production or immune cells. There's a large range. When you start to look at that average daily recommendation, sometimes if you look at like a vitamin or daily vitamin, you'll see that average daily recommendation oftentimes is what's in a typical multivitamin. But the tolerable upper limit for that is actually 4,000 IU. So there's a really big difference. So with all of these average daily recommendations and these tolerable upper limits, just know that nutrition and nutrients are specific for who you are and your health. If it's winter, if you're housebound, if you're institutionalized, if you're a night worker, you may need more than definitely the average daily recommendation and potentially even the tolerable upper limit. I can tell you that the American Academy of Rheumatology actually recommends 7,000 IUs for people with chronic conditions. So just kind of gives you an idea of the range there. Decreased vitamin D status has been reported in bovine coronavirus and calves, so not necessarily humans. A lot of the studies that we look at with regard to coronavirus, some have been done in humans, but a lot of them have been done in livestock because these viruses are transmitted very rapidly in livestock. And of course, they try to prevent the transmission in livestock because eventually that livestock winds up in our supermarket and then on our table. This is a systematic review of meta-analysis 2017 that looked at vitamin D supplementation to prevent acute respiratory tract infections. And they found that vitamin D reduced the risk of infection in all participants, so those people with infection and without infection, and that in some way it protected against acute respiratory tract infection for all patients. And that those that did not receive vitamin D who had a chronic condition were more likely to become infected with some type of respiratory infection. The dose in this particular study, by the way, I believe was 1,200 IUs, which is more than the recommended daily allowance. Vitamin A, it's also known as the anti-infective vitamin. It helps with a number of different mechanisms with regard to the body's defenses with regard to repair, and inflammation. Those that are deficient in vitamin A are more likely to develop severe cases of measles in children who have not been inoculated. So we do have research on that with regard to that particular condition. And then for some different types of conditions like pneumonia and HIV and malaria, those who take vitamin A supplementation are more likely to recover or have an easier recovery from those conditions. The recommended daily allowance is somewhere between 900 for men and 700 retinol equivalents, they're called. The tolerable upper limit for that is 3,000. So again, a wide range there. Vitamin C, many of you have heard things like vitamin C can help boost the immune system. It's a powerful antioxidant. It's also known to help produce collagen in connective tissue. What's interesting about vitamin C, it actually acts as a weak antihistamine. So if you have flu-like symptoms, runny nose, congestion, sinus infections, it's known to help with that. There are actually 3 good randomized controlled trials that support vitamin C with regard to the incidence of pneumonia specifically. And again, a wide recommendation of daily allowance to the tolerable upper limit. There is one specific study from 2003 that showed that vitamin C can help prevent SARS, a SARS coronavirus. And I believe that was done in livestock as well, not necessarily a human study. Zinc, you may find lots of people taking like zinc lozenges right now, or when people are sick, they take zinc. The best food for zinc are mussels or different types of shellfish. What's interesting about zinc, there are 2 parts of the immune system. There's the adaptive side of the immune system and the innate side of the immune system. So one side of the immune system produces the antibodies, and the other side of the immune system basically produces the cells that kind of gobble up the viruses and the bacteria. Zinc works on both sides of the immune system. So it's one of the few micronutrients as well as macronutrients that are known to help both the adaptive as well as the innate immune system. Again, there are some studies done on SARS coronavirus, specifically with regard to zinc. Zinc is known to be a powerful antioxidant. It's known to be anti-inflammatory. And it's also known to help with what's called the redox reaction in the body. So it prevents that oxidative stress from happening inside the cell, specifically with regard to RNA type viruses. And again, you'll see not as a wide range there with regard to the recommended daily allowance and the tolerable upper limit, but you can see there's still at least, if you double it, you don't even hit the upper limit there with regard to zinc. Most of these I pulled from this paper. It was published in January of 2020, Potential Interventions for the Novel Coronavirus, a Systematic Review. So this was published in China, but they did a really nice review of lots of different types of vitamins, minerals, micronutrients, macronutrients, dietary interventions, as well as pharmaceuticals that have an effect on the different types of coronaviruses out there. So there's a table actually in the study that looks at, so again, I like the way they kind of term this, general supportive treatment. So if you look at the left-hand side there, supportive treatments for coronavirus, many of the ones I just mentioned, as well as omega-3, selenium, zinc, and iron. And on the right-hand side, it shows you specifically which type of coronavirus, whether it's SARS or MERS or bovine coronavirus, as well as different types of influenza that the virus had an effect on. And then as you move down that list, the ones that are in gray there are the ones that are prescription. So you can take a look at that. It's a resource for you. What they didn't mention in that study, which is important, and I think it's something that everyone should know about, because you can purchase this as a supplement over the counter. It's also available as a nebulizer in the hospital. So N-acetylcysteine is a powerful antioxidant that's produced in certain types of cells and produced in the liver. And this is a powerful antioxidant. It scavenges free radicals. It also acts as what's called a mucolytic agent. So it breaks down mucus, specifically in the lungs. This was a randomized controlled trial that was done in 2018 in the Journal of Medicine that took a group of patients that had a community-acquired pneumonia that were in the ICU, and they provided them with 12,000 milligrams of N-acetylcysteine per day versus a control group. And they found that those who took the N-acetylcysteine, it's called NAC for short, had reduced tumor necrosis factor alpha, which is a inflammatory cytokine that the body produces, and an increased total antioxidant capacity. And I think that's really the key there. An increased total antioxidant capacity. It's really important when you look at oxidative stress and reducing inflammation in the body. And they recommended at the end of this study that this can be a treatment to help reduce oxidative inflammatory damage in patients with pneumonia. I know that this is currently being provided to certain patients in hospitals in New York. Certain physicians are starting to prescribe either N-acetylcysteine or its precursor, which is glutathione, for patients with respiratory tract infections, as well as SARS coronavirus here in the city. So when you kind of break all this down, the micronutrients with the strongest evidence for immune support are vitamin C, D, and zinc. There are others that may help: A, E, selenium, omega-3s, all the B vitamins, and then many plant phytonutrients have anti-inflammatory, antioxidant, and even antiviral effects to them. So all your phytonutrients are what you find in plant-based foods. So obviously your vegetables and your fruits. And then finally, I'm not an expert in Chinese medicine, but there is some information coming out of China that there are certain medicinal Chinese herbs that the Chinese have used, of course, in combination with allopathic medicine to treat coronavirus. People always ask me, because I am a nutritionist, they ask me, what's your normal daily supplement regimen? So I take a multivitamin, a multi-B vitamin. I take a probiotic daily. I take 1,000 milligrams of omega-3 fatty acid. I take 2,000 IUs of vitamin D, and I eat what's called a modified paleo-Mediterranean diet. So my diet is mostly a Mediterranean diet. I stay away from, for most part, I stay away from gluten and dairy. That's why I call it a modified paleo-Mediterranean diet. Now, what's interesting is I was visiting my parents in Florida when the coronavirus outbreak happened. So I actually had to get on a plane and fly back to New York City. I flew back the day before they closed New York City down. I flew back on a plane from Florida to New York City. It wasn't a very crowded plane, but there was potential that I was exposed to other people in public places. Where my parents live in Florida has a large elderly population. The airport in Florida has a significant elderly population. If you ever fly out of Palm Beach Airport in Florida, there's lots of elderly people who live there, fly back and forth to all parts of the United States of America. So I basically applied research to myself, and this is what my supplement regimen looked like about a week after COVID-19. So I increased my vitamin D to 5,000 IUs for 10 days. I took some N-acetylcysteine, 1,000 milligrams twice a day for 10 days. I did what's called a vitamin C challenge. So vitamin C, it's well known that what the average human needs with regard to vitamin C is very specific to who you are. So the way they figure this out is by what's called a vitamin C challenge. So what you do is you take 1,000 milligrams of vitamin C every hour up until the point where you have loose stools. When you develop a loose stool, it tells you that you've reached your max vitamin C level in your body. So what you need to take each day is just somewhat slightly below that. So for me, it's about 2,000 milligrams of vitamin C. So you figure that out by giving yourself a vitamin C or taking what's called a vitamin C challenge. You can buy buffered vitamin C. It's a powder. You can mix it with water or fruit juice. Vitamin C alone tastes horrible. So I recommend you mix it with some type of fruit juice. And then you can try that challenge for a couple of days and see where you hit the point of having a loose stool or some type of bowel dysfunction, such as gas and bloating. It tells you you're at your upper limit of vitamin C. I took some zinc lozenges for 4 days and then some natural antimicrobials like oregano and berberine. These are often common combination formulas. Oftentimes, when you have a virus in your body, not only is it in your sinus tract, but it's also in your digestive tract. When your immune system is compromised, or when your immune system is fighting a certain virus or bacteria, it's more likely that other types of infections can increase in your body. So antimicrobials are a nice way to kill certain bugs in your gut. So basically, this was my supplement regimen after COVID-19, after flying on a plane where I potentially was exposed to people and returning back to a city that, of course, is under quarantine at this time. Just a quick list of some immune boosting foods. If you want to take a screenshot of that, you can. So when you go out to the supermarket, see if you can find these and put them, of course, in your shopping cart. And then maybe go online, Google some great recipes where you can use these, of course. You can take supplements, but I always recommend a food-forward approach to every single person who is looking to use nutrition to optimize their health and, of course, support their immune system. So a list of 20 immune boosting foods you can take. And of course, I'm in New York City. It's quite shocking to me that the foods on the right are actually not available. People are buying these foods, but yet the foods on the left are the foods that people are leaving on the supermarket shelf. And I'm doing the exact opposite. Yes, it's nice to have fresh fruits and vegetables. Of course, you can also buy these frozen, or if you buy them fresh, you can freeze them. So this is where all your nutrients, these are where your vitamins, your minerals, your antioxidants, your phytonutrients come in fresh fruits and vegetables. This should be half of your plate at least, if not upwards of 75% of the food on your plate should look like something that's on the left-hand side of the screen. It's actually not that hard. So you can take a nice whole grain piece of bread. So not white Wonder Bread, which really is sugar for lack of a better word. Take a nice multi-grain heavy piece of bread that you can, when you can feel like the seeds and the whole grains in it. Take about a quarter of an avocado, mix it with some olive oil, spread it on that piece of bread, and you can poach an egg. If you have some leftover spinach or some broccoli rabe from the night before, you can place it on that, and that can become a really nutritious breakfast for you. You'll get lots of your recommended and more than your recommended daily amount of vitamins and nutrients just from that breakfast alone. Lunch can look something like this, where you have some chopped avocado with some seeds, some mushrooms there, which have great antimicrobials, some peppers, a little bit of parsley, or what is that? Those are chickpeas there. There are lots of great things you can place in your plate for lunch. You can take some sardines or tuna or anchovies or some chicken or some beef from the night before and add it to that salad so you have your serving of protein that's there. And then for most parts of Canada and where I live in New York, it's actually still cold. So if you want to create some nice chicken soup or you want to make some nice vegetable soup, you can do that really easily. You just saute some olive oil with all the vegetables. You throw in some either vegetable stock or some chicken stock. If you want to throw in some chunks of chicken or chunks of sausage, you can do that as well. These are the types of food that you have that are really nutritious. You can freeze these and they last for many, many meals. Put in your freezer, it lasts upwards of three months. And this is the way that you learn to cook and you learn to eat. This is the way that you learn to counsel your patients to cook and to shop and to eat. And this is what prevents chronic disease, which is what, unfortunately, is impacting many of the people that we see right now who are infected. Now, even if we didn't have coronavirus right now, this type of approach helps people with chronic pain, helps people with obesity, helps people with cardiovascular disease, diabetes, cognitive function like depression and anxiety. We're really looking toward a whole food, plant-based diet to treat many of these comorbidities that we're seeing in clinical practice. So I want to thank all of you for joining me today. Hopefully you learned something that's useful on how you can apply nutrition either to yourself or your friends or your family, and of course, your patients during this time. I just want to share some resources with you. You can find everything about me on my website, which is called the Integrative Pain Science Institute. So if you go to integrativepainscienceinstitute.com, and if you're interested in nutrition specifically, I have a couple of great free resources that I'd love for you
to download and learn from. So if you go to the course tab and you go down to free training, there is a free guide on nutrition for physical therapists. This will, of course, relate to not only for physical therapists, but also for occupational therapists, physicians, nurses, really anyone who works within the context of chronic pain. And then I also have a free masterclass. So if you again go to courses, free training, chronic pain masterclass, and you can sign up for a free masterclass that's about a 60-minute presentation where I kind of go deeper into the nuts and bolts behind nutrition for chronic pain, and of course how it relates to chronic disease and specifically within the context of physical therapist practice. Okay, I am Dr. Joe Tatta. It's been a pleasure being with you all. Hopefully you learned a lot. And if you have any questions, you can, of course, reach out to me. You can email me at support@integrativePainScienceInstitute.com. Okay. I wish all of you that you stay healthy and well during this time and safe. We'll get through it. And nutrition will be one part, along with exercise, that'll carry us through to a healthier world. Okay. See you soon. Bye.